Good afternoon, everyone. And for those watching online, we are coming to you live from the Vantiq House in Davos, Switzerland. It's been an absolutely incredible week. My first time in Davos and company's first time in Davos. There's been this weird conversation or thing, something called AI, that I keep seeing everywhere. I'm not entirely sure what it is, but I think we're going to get some answers, hopefully. Before we sort of dive into going deeper on what Vantiq's doing, as well as some of the projects that we have across the globe, I want to ask Marty, our CEO, to talk a little bit about what your experience has been like this week, what you're seeing, and sort of some of the key takeaways you've seen as we kind of wind down Davos.
Okay. First of all, Davos is equal to AI this year. Every sign you see down the promenade, every company is talking about AI. And everyone's talking kind of the same way. AI for good, AI to make productivity work, AI for you name it, education, etc. The challenge we have is we're at the very beginning of AI. So what all these companies are saying, which is very similar, is in an early market. So we know all the chips, NVIDIA chips and others are there to create the environment, the infrastructure for AI. What's this AI going to be used for? Now, one of the challenges is everybody's talking the same way. We're going to use AI as avatars for humans to make productivity occur, a more efficient world, etc. But there's something missing, something big missing, which is we're going to be using AI to address what's happening in our world in real time. And there's really no discussions of that. It's discussions of, sustainability. How do we make the world more sustainable? But what about how do we deal with events that are disasters? We just had major fires in Los Angeles. There are floods in Valencia, Spain, unlike ever before. This is a one-way street. This is going to get worse. AI can be used for that. That, of course, is what Vantiq is about. But we also believe there will be a transition occurring very soon where AI is going to be recognized as a means to basically help our world deal with the challenges that are occurring. And I think that's not yet being represented. We're at phase one of the use of AI. And as interesting, as powerful as that is, phase two is going to be bigger. And that is making our world work better and dealing with problems as they occur.
Marty, it's an incredibly bold vision, and one in which I think you have a little bit of credibility to be sitting here and opining about where the future is going. So why don't we wind back to the early 90s and tell us a little bit about the work you all were doing and how Forte came about and what Forte really pioneered.
Okay, so back in the 90s, I formed a company with Paul Butterworth, my current co-founder, who's our CTO, that basically was promoting the internet. In the early 90s, there was a big question about the internet. In fact, getting funding was a challenge for us. Some of the venture capitalists we spoke to said things like, this internet thing, it's going to be a toy. It's my grandmother will never use the internet. We eventually did get funding. And I remember the first time I saw in a advertisement in a magazine, www, and I went, yes, this internet thing is really happening. But it took a while for the world to transition. And to your point, there are a lot of similarities today. Today, as we move into real time, as we monitor the world and make it safer, and also as we make people healthier, because healthcare, which of course you're involved in, and which you could speak to a drop, is a huge opportunity for us to not just save lives, but to make lives better. So this change is basically going to be, we're going to monitor the world in real time, monitor people, and it'll be used to make the world a safer and better place. And we need to do that.
There's a number of things you touched on that I think we want to unpack. It's important to think about what's happening just in the proliferation of sensors. The predictions that by 2030, the IoT market, not just for healthcare, but the sensors that live around us, is going to be more than anyone can really comprehend, more than any database can store. There's going to be so much data and so much noise being produced from that the concept of how do you act on these things in real time, how do you bring these things together and make sense of what's going on in real time, is going to be a fundamental shift. So talk a little bit about now 2015, you and Paul are starting to think about Vantiq and what's going to be required to build the type of platform to address the challenges we're seeing today?
Okay. So first of all, there are a lot of sensors being built in the world. In the human body, we have all kinds of vital sign sensors. We have Aura rings. We have the Apple Watch, which can monitor you. In addition to sensors, data can be acquired, like weather data or data from satellites as to what's happening on the ground. Is there a flood? And all of this data can be combined, can be merged together. Now, there's another phenomena, or two more phenomena. One that's going to happen is it's a feedback loop. As we start getting more data from these sensors, we're going to require the sensors be more intelligent, do more. We're already seeing it with Apple Watch doing more and more over time, especially in terms of vital sign monitoring. And systems like, or sensors like the Aura Ring are being produced very quickly. It's going to accelerate. The amount of sensors in the world is going to grow like crazy. So it's a feedback loop, because as we use that data, we're going to generate more data, and these systems are going to become more powerful. In addition, the second thing that's going to happen is we're going to do different types of analysis. So right now, we have pretty static analysis, computer vision being one of the big ones. But there's a whole area called spatial intelligence. How do you monitor what's happening as things move through space? And there's research and actually products being built right now to do it. So for example, if you're monitoring a human, you could monitor their gait, how they walk. And you could see if in fact their walk is degrading in a remote patient monitoring situation, and see if the person is degrading over time, or if their walk becomes really bad very quickly, maybe they had a stroke, maybe an intervention is needed. This spatial intelligence is a new type of intelligence. So we're going to see new types of intelligence. Acoustics is a whole nother area, sound. We'll be able to monitor what's happening, and including different types of sensors. So right now we have computer vision. Computer vision might see if an adversary enters a certain area, possibly a terrorist. But it sees the terrorists and it sees them moving through space, and you can tag them and track them maybe across a particular area. But what do you know what they're doing? What are they wearing? Well, if you use X-rays, for example, you can see if they're wearing an explosive vest. So this combination of new sensors and new technologies is going to change dramatically. And as I said, it's a feedback loop. As we monitor what's happening, we're going to monitor more and more, and there'll be more and more sensors to do more. This trend is incredibly large and significant, and it's going to happen soon, over the next few years. As we move into real time, the ability to monitor more and to analyze it using generative AI, because there's too much data. You can't do it deterministically anymore. You've got to get all of this data in and use huge databases of information to evaluate it. Train models that can predict what's happening and what is possible to happen and recommend what to do about it.
So I want to pick up on the real-time aspect. We talk a lot about this. We position heavily on it. I'm sure most of the folks in the audience, when they're text messaging or FaceTiming, you think it's real time. So what is real time, and why is it so important, and also unique and different from traditional database architectures?
Okay. When humans interact with computers, that is, you're doing it in real time, for sure. And most people watching this, for sure, have used ChatGPT or equivalent, and you're already creating prompts and asking simple questions in human time, that type of real time. But that type of real time takes seconds, sometimes many seconds, and therefore the response from these systems can also take many seconds. So you might have an interaction that takes 30 seconds or more. But if you have autonomous vehicles moving, you don't have 30 seconds. Or worse, if you have drones coming at you, maybe with an adversarial approach, you want to respond to those systems exceedingly quickly, not even in seconds, in milliseconds. That's going to transition the way we use this AI. When we define real time as things that are happening that are dangerous, it could be a flood, a tidal wave coming towards you, could be an autonomous vehicle coming towards you, or a drone coming towards you. Then you need to respond in seconds. And these systems, these generative AI systems, are going to be able to do that type of response. We're already seeing innovations coming about that enable these systems to respond in 10, 50 milliseconds, super fast. And that's going to be a requirement. That's going to be a huge change in our industry because the real world operates that way. And humans, when you're walking and you have to divert from something that's coming your way, it could be something simple like a baseball, you've got to respond very quickly. These types of systems are being built. We're pushing that technology very strongly at Vantiq. We see that need, and that's what we're about. That definition of real time is very short. It's not human interaction real time, it's systems interaction real time, often to protect humans.
And it's also unique because if you think of the concept of this real-time architecture, you're not storing data and then processing it and analyzing and all the subsequent actions. You're thinking about how to bring pieces together and look for something in a window of time. I can think about healthcare. I'm looking at a patient's heart rate and their pulse ox, and I'm trying to combine those within the span of a minute because heart rate an hour ago and pulse ox 2 hours later, those things are irrelevant, right? So I'm really looking for specific correlations of multiple streams of data in a small window of time. I need to be able to process and analyze that before I'm even storing the event or the data. And so some of the ways in which these applications are going to be built and the way that AI will be deployed is really going to be unique and change. Where do you see the biggest opportunities as well as the biggest challenges in the market today? Sort of taking the step from where we are, as you described earlier, how we get to that next step and truly seeing these real-time intelligent systems in production.
Okay. Before I give the examples, I want to build upon what you're saying about the real-time aspects of it. We in data processing or information processing have always worked upon a database. Everything goes into a database, you analyze it from a database. We have to make a transition. When we move into real time, we have to deal with events. As events occur and deal with them, sometimes milliseconds, sometimes a second, but super fast. And you cannot put all that in a database, meaning you've got to fuse and analyze that data as it's coming in. So to your question, where is that important? It's important if you're in a flood, if you're in a hurricane, if you're in a traffic incident, in defense, if there are missiles coming your way or drones coming your way and you've got to respond quickly, there is no time to take. You've got to respond super fast. Therefore, you don't use a database. The use cases we've seen that are right now the most benefiting from this type of approach, healthcare big, as you point out, because things can happen quickly and you need to react quickly, whether it be in the back of an ambulance, as we do, or out in the field if somebody is having some event that has to be analyzed super fast. So healthcare is a huge market. Disaster management, again, the fires that we've seen, the flooding that we've seen, the droughts that we've seen, the heat stroke situations that have been occurring, these situations require super fast response. So healthcare is another one, and defense, as I mentioned. So it's really disaster management, healthcare, and defense. And by the way, who is funding this? The funding is coming a lot from governments right now who have to save their people. And defense is obviously government. Healthcare also is often government funded, or if not, humans are driving that need. And disaster management is, of course, government funded. So governments right now are really starting very strongly to focus in these areas, and they have to, because they represent humans, the population, who are being affected by these traumatic types of events.
You said something interesting earlier about it's not the human interaction with the computer in real time, it's the computers themselves and the systems interacting in real time and almost serving us as the individuals that are interacting with them. And that creates sort of this unique opportunity. And some of what we're seeing in AI is our general interaction is I prompt the system and get a response. A lot of what Vantiq's doing is it's actually the system communicating with you before you've ever asked it a question. It is bringing some of this Tony Stark Marvel-like creation to life where you have an avatar or a system that's continuously monitoring you and saying, hey, Marty, noticing you're climbing up some stairs, your heart rate just went up. You may need to sit down a little bit because you remember last week when you fell? That's a real transition point in what AI can do for us. So talk a little bit about how important that's going to be in the types of applications we're building.
So these avatars or these systems, as you're talking about, they can interact with humans very quickly. So let's talk a little bit about a situation such as a flood or a fire. So what the system can do is communicate to the human over the human's, let's say it's a smartphone, over the smartphone, and say, do you want assistance? You're in an area that a fire is coming towards, and you probably need to evacuate. And you respond yes. And the system says, should I give you ways of getting out of there? And you respond yes. And then the system will track you as you're leaving that situation, assuring you're getting to safety. And if the fire changes direction, it's going to redirect you. Or if it's a flood, it'll guide you away from the flood. And if a bridge collapses, it'll re-guide you in a different way out of there. So guiding humans in these situations is absolutely critical. But also, to your point, getting other people, first responders, to get to these humans that are in trouble is very important too. So you could be monitoring their vital signs to see if they're in trouble. And if they are, you can automate the response to the first responders and basically triage it, saying, this person's in some trouble, this person's in a lot of trouble, and go to the people in a lot of trouble very quickly.
Yeah, and it brings up sort of a very unique possibility for what the future of AI can do, because it's not just about the prediction models. Those are going to be important, but how these models are analyzing and enabling a system or an agent, which is the buzzword right now, to interact with multiple people and to change. So an example we see in some of our work is heat stroke. You have an agent talking to multiple different people, the person who's affected, the workers, the individuals who are monitoring the location. And as humans are interacting with these systems, the agent themselves are changing the response to you. So it reaches out and says, hey, Ryan, Marty's in trouble, he's having heat stroke. While you're having a conversation with it, it's actually changing its conversation with me. And I think that's a dramatic departure from a lot of the chatbots that we're seeing that are sort of very deterministic. I mean, there's a training data or training model. You can ask it a question. You can go to ChatGPT and say, what's the time? It says, I can't do that. But you can add a function and then it does that. But the idea that you have these systems that are actually evolving in real time, learning in real time is a huge leap forward. Discuss a little bit about how what we're doing actually enables that to come to life.
Okay. So we automate the use of generative AI, and we could call the generative AI systems and pass the prompts to it that are created in software. So no humans needed. And based upon its response, we can create other prompts. But what we're also doing from all these sensors is monitoring the environment. So as you said, Ryan, there could be 3 or 4 people, say in one area, and one person is experiencing heat stroke, or maybe they're not even aware of it. Then the system can communicate to other people. So we're using generative AI systems that are communicating to multiple people and saying, hey, Fred, go help Ryan. His situation is getting really bad. And so rather than even wait for first responders, you can get groups of people to respond and guide them. So in healthcare situations, say, for example, somebody has a heart attack and you want to use a defibrillator. So therefore, you can actually guide the person next to the person who's having the heart attack to use the defibrillator. We have a situation where a system is being built right now that'll be built on drones for areas like golf courses. And so if somebody has a heart attack in a golf course, a drone will be automatically dispatched to that person with a defibrillator, and then giving somebody else their guidance on how to use the defibrillator to help that person and monitor the whole thing. This is not science fiction. It may sound like it. We're building that system with a partner today. This is the types of systems that can be built. And tying back to the very beginning of our conversation, they're all real time. They're all what's happening in real time, and there's no time to waste. We're dealing with seconds at the most, maybe milliseconds to act, to save lives.
So as we sort of wrap up, I wanted to get your final thoughts. One major takeaway from this week, and one major call to action that you see that's necessary to move from where we are today to the promise of tomorrow.
Okay. Well, what we've seen this week, as we said at the very beginning, everybody is talking about AI. But the point that I want to make is it's early. we're using this first generation of AI, typically generative AI, to make people more productive. We've all done that. It makes you far more productive in creating documents, in creating presentations and the like. Very powerful. But the transition to real time is just now starting. And we see it because as a company, that is what we do. We do real-time systems, create generative AI systems that can react in real time. This trend is now just starting. So we've spoken to a lot of people this week who said, wow, that's interesting. Or even, is that science fiction? Is that real? And the answer is yes, it's real and it's happening now. We're going to see a change in our industry as we move to real time using this technology that is bigger than the internet itself, because it's going to save lives, deal with worldwide disasters, which are getting worse, and it's becoming available right now. And the world needs it.
And one call to action?
The call to action is we all got to think through, how do we build these systems? What are the ways we can use? What are the technologies we can use? Now, obviously, we care because that is what Vantiq does. But there are ways to do it in these systems by creating these agents that will address these types of situations, and they have to be built. The call to action is we have to start thinking that way. We all talk about sustainability, very important. How do we buy ourselves enough time to get there? How do we deal with the challenges in the world and save lives while we're making the world more sustainable? So the action is we've got to think through, how do we do that? How do we build these real-time systems that are absolutely required to basically save our world?
Well, it's going to be an exciting year. Thanks for joining us today.
Thank you.
You want to open up for questions as well?
Yeah. Yeah. Any questions?
I'll start it off.
Sorry.
So
So I need to
you guys talk about AI as, a collection, and you referred to it multiple times, but there's lots of different things when we say AI. And I'm curious your opinion on, for example, the advances in large language models. Large language models, are they going to become bigger and better and able to do more things, or are they going to become smaller and more specialized and require actually shrinking what they're able to do, but becoming more effective at that small task?
So from a healthcare perspective, what I believe will happen is you're going to have use for generative AI, but the large language models will effectively be replaced by much more smaller and focused models. You'll have a model for cardiology and then subset that cardiology model into heart failure, into intervention. Then those are going to be replaced by more advanced multimodality or multimodal models. So if you take, let's keep on cardiology, so working about the heart. If I take all the textbooks, I can have immense knowledge that comes from the evidence. But if I can combine that with echocardiogram, so the actual video looking ultrasound of a heart, if I can do that with MRI data, if I can start to combine more of this data together, then the model is going to become much better. We heard this week, the foundation of the models that exist today on the large language models aren't capable of sort of doing that next generation of what people are transitioning to, right? It's a text prediction, token prediction, but really sort of generating an echocardiogram from sort of data is not possible today. And so that, I think, is where the evolution specifically for healthcare will go. And it makes a lot of sense, because if you think of any type of profession like healthcare, highly specialized and is only getting more specialized. So just to give you all a sense of what we as physicians deal with, sort of a cognitive overload, in 1970, do you know how long it took for medical knowledge to double? Does anyone have any idea? 1970.
No.
50 years.
Yeah.
So it was 50 years medical knowledge was doubling. If you go through every 30 years subsequent to that, and you look at today, how fast do you think medical knowledge is doubling today?
5 years.
Yeah, 5 years.
1 year.
1 year,
10 years?
10 years? Any guesses?
49 years.
49 years? Roughly 40 days.
No.
Wow.
That's cool.
Serious. Roughly 40 days. That is going to accelerate when we introduce artificial intelligence into the knowledge production. If you track, and this is another interesting phenomenon, if you track from 1970 to today, the other thing you can see in healthcare is the specialization. Emergency medicine doctors were internal medicine doctors in the 70s. It only became a profession. Interventional cardiologists, interventional radiologists, subspecialty in healthcare. You saw healthcare start to fraction into highly specialized individuals as the knowledge doubled. So any profession like that is highly specialized, I think you're going to see a need for highly specialized models, because the practitioners, the individuals that will deploy those models, that will use those tools, have such now a nexus of expertise that it isn't generic anymore. And so I think the models, I believe, will need to follow the way in which the care is delivered.
There's another aspect. Let me just add to that. You asked about where these models are going to run. These models are going to run everywhere. You cannot depend on the cloud. If you're taking images, or especially if you're doing spatial intelligence and you need video clips, those networks are too slow and not reliable enough, meaning that you've got to put the AI where the problem is. If you're in an ambulance, that AI has to run inside the ambulance. If you're in a defense situation, it's got to run where the troops are, right where they are, for security reasons as well. So that means there's going to be a huge trend to the models being somewhat smaller, maybe a terabyte. They're not going to be monstrous because they're going to be more specialized, more efficient, and they're going to exist everywhere. This is a major change in the architecture of these systems. So as Ryan's pointing out, these systems are going to do so much more and be so much more capable, and they're going to be all over the place. And they're going to be used as the data comes in, where the data is coming from, and then actions are going to be taken right there. It's a new world of computing, guys, a whole new world that we're dealing with, where computing is going to be everywhere, doing things we can't even think about, and it's going to occur in the next 5 years, faster than we can even imagine.
Yeah. So, yeah, please go ahead.
A question to both of you. I don't know. We were talking about taking action, right, in healthcare. Taking action, like somebody coming with a drone to assist you, you're having a heart attack. What about, do you have any information on cancer research? You're saying that we are advancing at the speed of 40 days.
Yeah.
Any info on that?
I'll make a slightly pithy comment. There's a recent big announcement about AI, and unfortunately, we're not anywhere close to the idea that AI could help produce a robotically processed mRNA vaccine to treat your cancer in 48 hours. That's not possible. In the future, I think we all hope that to be possible. From a cancer research standpoint, particularly where AI is going to be incredibly helpful, is on two domains. One, clinical trials are very expensive. And getting to more precision medicine, precision oncology requires not only an understanding of the genomic sequencing of the individual, so you as an individual, what makes you unique, and then understanding how the cancer is affecting you and what particular chemotherapeutic agents we have that are going to benefit you, or what regimen is going to benefit you, or even what radiation plus chemo or surgery. I mean, there's all different protocols. Understanding that for you is going to speed up. And that's really important. We're good now. I mean, there's some sites around the country that do a phenomenal job at this. That's going to get faster and it's going to get more personalized. And because of that, I think it's going to get more accessible. I mean, one thing that's true is if you go to Dana-Farber or you go to MD Anderson, you're going to get the best care in the world. But that's not true for everyone around the world. So AI can also democratize that accessibility. So I look at it as two sides of the coin. We'll speed up our ability to get more diagnostic and personalized for you. But because it's not reliant on me as a human, I can scale it much easier, which means I can get these types of systems to more people around the world, which is better because more people have access to it. So I think to me, that's the next turning point. There's going to be a lot of work down the road about what we do and our ability to use particularly new models of AI to understand, and I'll get overly clinical, understanding how to design therapeutics and target therapeutics to specific proteins and specific cellular signaling pathways that are the byproducts, or at least the starting blocks of cancer. And so eventually we're going to get much further upstream where we can recognize before cancer is even visible that it's forming in the body and attacking it. We'll get there, but that's still years away.
Okay. Thank you very much. I have a question from a financial perspective. Okay. So I think on Tuesday we had an interview with Vantiq as well, and it was a question about the impact that AI is going to have in volume of unemployment in America, right? Lots of people are expected to lose their jobs, right? So I explained that in general, when new technologies are incorporated, on the short term, sometimes there's a negative impact in employment, but over the long run, there's a highly positive impact in employment, right? But that's a general response that I can provide. So you guys as experts in AI, I'd like to hear from you. Where do you see that AI will shed jobs first? And where do you see AI creating more jobs in the future? Mostly thinking about like East Coast America, West Coast America, sophisticated areas of work.
Well, it's going to be shed first on jobs that are trivial and repetitive. I mean, look at accounting when spreadsheets and computing systems came into place. There are used to be so many accountants, but all of those accountants, were replaced by other knowledge workers. And my belief is very positive. There are going to be knowledge workers doing things like we've never thought about before. First of all, going back to what I said about the world having its challenges, those challenges need to be addressed. Maybe there'll be a lot more people involved with sustainability activities because there'll be more time for them to do it. And it's hard to predict, and I certainly can't, where the knowledge workers are going to exist, because you've got to basically predict the future. But I have a very strong feeling that knowledge worker needs are going to grow, and people are going to meet those needs. And so it's a positive aspect from that perspective.
So jobs that require more sensibility and the ability to interpret things will be preserved, and jobs that are more repetitive are expected to be extinct.
That's what's happened in our history in the Industrial Revolution. And it's going to continue. There's no reason for that to stop. Yeah.
There's a shortage of doctors, there's a shortage of nurses, and there's an aging population globally. You can see it most prominently in Japan, but US isn't going to be far behind. And so how we deploy these tools that significantly enhance productivity, that make a physician not just capable of monitoring 10 individuals remotely, but monitoring 30 and 40 and 50, doesn't just have an economic benefit. One of the limitations of telehealth or remote patient monitoring is there's still a clinician on the other side of that has to be available. You still have a limited bandwidth. It's not a technology problem. It's a personnel problem. And so if intelligent systems are making us more productive and efficient at diagnosing, at triaging, at the administrative burden that's placed in a hospital or health system and workers, productivity increases. And so I certainly don't see in healthcare why this will replace jobs. I certainly do not see a time in which AI could ever replace what physicians do. But if you think of any innovation that's come into medicine, if you think of probably the most poignant one was the innovations of any type of interventional procedure. So in the 70s, if you had a heart attack, they opened up your heart and did a vessel graft. And then a number of folks got really clever and said, I bet we could take a wire and get into the heart. Sounded completely radical, but that is actually standard of care today, right? Unless you're in a certain class of individuals, then cabbage is still the best practice. But most people, if they're having a heart attack and they come into the hospital, you go to a cath lab and they put a wire in and put a stent in. Cardiothoracic surgeons thought it was the end of their profession. They were going to disappear because these people were stealing all their cases. What happened? They didn't disappear at all. They got more specialized and got better at the procedures that still require those individuals. And we have a better system of care because now individuals aren't having to have open heart surgery for every single cardiac event. So I see AI as doing the exact same thing. It's not, it's going to, the same way that those innovations sort of created new, I don't know what that new is, it's going to create some type of new system, new worker, new knowledge worker.
There's another phenomenon I want to add to that, which is worldwide, we're going to be able to help third world nations unlike ever before, because what do they need? Connectivity for sure, AI, which is getting cheap, running everywhere to monitor food supplies, water supplies, disease states. I mean, the whole world is going to be somewhat levelized by this technology. And it's going to take some time, but it's a major trend. We're going to see such a difference in 20 years on how, because of technology and AI running everywhere, how the world can exist. And it's going to be a leveling effect, very effective. On the other hand, what we have to do is for sustainability and managing disasters, we've got to be able to get to that time. So you've got to also, in real time, figure out how we could enable us to live as a species in this world with the challenges that are current.
Can one else? You in the back, sir.
I'm James Ong here from Singapore. I agree with what Marty said. The next wave is going to be real-time AI. Because I think technically it's a much harder problem now, because even with real-time, decisions are made by system. And so it has to make a decision, and a group involving a human to make a decision, even for non-real time. But when you're in real time, there's no time for human to make any decision at all. There's no framework in the loop, right? How do you build AI system that is aware in real time to know that it needs to escalate to human? I think that is
That's a
almost
great
question.
That's a great question. Now, there are two aspects to it. One aspect is trustworthiness. Is the AI giving you good advice? And there are techniques you could use, what's called retrieval augmented generation, to get knowledge that's specific to you, to make it more reliable. There's another technique, which is a patent we have, to get multiple systems to agree. And only then will you make a decision. That's been used by the military for decades, when they get 2 or 3 people to agree before action is taken.
I see.
Why not do that in software?
So second opinion, third opinion.
Totally. So we have an algorithm and a patent on it that you get 2 or 3 LLMs and maybe a non-LLM. And if 3 out of the 4 agree, then the decision is taken in real time. The second part of your question is, how do you orchestrate the response? So, for example, say in the defense situation, say a missile is coming your way and you want to send off a kamikaze drone to intercept it and to blow it up. So, and you only have the missile, say, 20 seconds away, and you may or may not be able to depend upon a human to make that decision, and you don't want to take the risk. So you send off the drone, but the drone can be stopped by the commander in charge if you give him the information, and then he could look at it, say, here's what I analyzed, here's what I did, and he could press the stop button if need be, because there's some reason to stop it. So you need to be able to get humans involved, and maybe more than one human.
Yeah.
So that's the kind of system we built to orchestrate the response to one or more people. And if he doesn't respond, you get someone else to respond, or get multiple people to respond, giving them the power to analyze what the AI system is doing and to change it. So that has to be part of this. It may not always work, but you have to at least make that available to work.
So right now, your approach is a patented approach right now.
Yeah.
Something that you have unique to solve the problem.
Yeah,
It's
that,
pretty cool. Yeah.
Vantiq, we have a patent, because we were the first to come up with the idea of getting multiple LLMs to agree on a decision, such as that missile decision.
Very logical.
Yes.
Even without real time, I'm doing it myself
Right.
today.
Yeah.
But you're actually automating that part of the decision.
Exactly.
That's actually how viewers make decisions too, right?
Yes.
It's a very important decision. You gather
Yeah.
experts and you look at it from different angles and then decide
Right.
how we want to move forward, right?
We tell our healthcare clients it's the second opinion, right? So I'm a hospitalist. I'm not a cardiologist, so I know enough about cardiology. But when I need a second opinion, I call a cardiologist. So it's the same concept. I could have the system analyzing what's going on, and instead of just one LLM, I could have multiple. I could have small models. I can have multiple sort of agents,
Opinion.
effectively multiple opinions, and I can set the threshold.
You should sell it to the White House before the press alone.
But Martin, you said that the network is not strong enough to hold it. You said the web.
Well, it's not a network problem. You have to have strong networks and secure networks. Obviously, for almost everything we mentioned, you need a secure network. The networks are getting there, and you need backup too. So you have satellite networks that back up, terrestrial networks. So the networks are generally not a problem. What I was saying is they're not wide enough, the bandwidth, to transfer huge amounts of data.
Okay.
So you don't want to transfer video sequences, for example. It takes too much time. We know from downloading to our phone. And if your network is not strong enough, or if you have loads of video sequences, you can't transfer them. You've got to make the decisions locally. And that's why I said the power of the AI has to run on the edge. And it is. There are technologies, both hardware and software, coming to the market to do that. We understand that. As a company, we're building distributed systems so that you can automate that, so that you could have it run on the edge or backed up, run in the cloud, and so on.
So just to add real quick to the point about different places a human sits in a decision chain. One of the things that's quite important, certainly in defense, but also around legal legislation holding skin to account, is whether a human is in the loop, on the loop, or absolute. And you need to be able to set that yourself depending on your own decisions. But also, taking defense specifically, it may apply in medicine, but it will apply in release cases. The legislation that supports the actions taken, what an effect it does as a result of sensing a decision being made by an AI system, and I don't think how many it was. The legislation surrounding that is likely to insist on different levels of human intervention. So if you live in a Western nation, and we're talking military now, you would not be authorized by the law to have a system that was fully autonomous, unless it relates to Marty's point, to save lives. It was self-defense. And if you transgress the legal regulations that you're given, the rules regulations, then you're likely to go to prison for use of that system. So it's quite important in terms of how the system set up versus the law. But how do you make that where we have to now establish those rules across every single AI system that's trying to be deployed across every single environment that now has nuances to their rules of management or the way in which their humans are operating or the way in which they want to do that decision making that is mapping onto their current process? It's like, how do you actually make that work for every single deployment? So it's like baked in from the beginning. So one of the things that has to be considered by the people who put together the business system that, say, fires a missile is from the outset, it has to be able to cope with emotional regulation, legal regulations like that. So it wouldn't necessarily be something that Vantiq is involved in, very honest, but we are still told to have settings exactly as it's described earlier on by Ryan. We've got to be able to set it up to correspond to where it shows.
Very cool. All right, we're gonna get ready to kick off a discussion around healthcare. Take 5 minutes. There's refreshments back there. We have a panel that's actually walking up right now, so I think you all enjoy it. We're gonna go pretty deep into healthcare AI, and then defenses after that.
Okay.